So if a patient has been prescribed medication but their symptoms disappear, should they continue to take it?
Well, that depends on the type of medication that they're taking. Certainly there are some medications that are meant to be as needed, so PRN use. So for example, if you've been prescribed beta-histine for a condition called vertigo, where you are experiencing dizziness, certainly if the dizziness resolves, you can consider stopping your medication. There's also another class of medications where we absolutely do not recommend that you stop taking your medication when the symptoms resolve, and that's in the class of antibiotics. Consider bacteria as bugs, and say you take you're on day 5 of your treatment, of a 10-day treatment, and your symptoms have resolved, and you've probably killed off the majority of these bugs. However, if you stop at that point, there are some stronger bugs that are lying around that have not yet been killed. And because you don't complete your treatment, you allow those bugs an exposure to the antibiotic, which then gives them they're very smart, so they have the opportunity to morph and mutate and change so that the next time they have exposure to that antibiotic, they basically are able to fight off and not be as affected by it, and therefore this leads to antibiotic resistance. So, bearing any allergies or any ridiculous side effects that you would be in contact with the pharmacist about, you definitely want to complete your antibiotic therapy.
I know a lot of people that do that, so that's good to know.
Yes, absolutely. Very important to prevent our resistance that we see occurring, and certainly a concern for the healthcare system.
Well, thank you so much.
Yeah.